Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life.
Stroke. Stroke is the term used to describe a sudden loss of function in a portion of the brain. Typically, the loss of function results in difficulty in moving an arm or leg, paralysis. There may be loss of feeling or peculiar sensations in the same areas. A stroke may also appear with problems relating to speech or vision, or as a convulsion. The loss of brain function is due to a sudden reduction of the blood supply to a portion of the brain. The reduced blood supply may be due to clogging of the blood vessel by thickening and hardening of the vessel wall, atherosclerosis, or rupture of the blood vessel with bleeding, hemorrhage. Once started, a stroke can continue to damage the brain either by clotting around an obstruction or by further hemorrhage. Pakshagatha is the Ayurvedic term for paralytic affliction. The Ayurvedic texts generally attribute such condition to a block in Vatha's movement. Some strokes, known as transient ischemic attacks, TIA, cause symptoms that last only for a short time. The cause of such attacks is not certain but is generally thought to be due to a spasm of a blood vessel to the brain. A transient ischemic attacks can have many forms, from a momentary change of vision to a brief paralysis of a limb. Sudden lapses of attention or passing out are sometimes the only evidence of a transient ischemic attacks. When brain tissue is damaged by a stroke, it may recover fully, partially or not at all. Recovery may occur in a few hours or days, or may stretch out over many months. The major causes are hardening of the arteries, atherosclerosis, high blood pressure, and diabetes, which often hastens hardening of the arteries and increases blood pressure. People who smoke or are overweight are more prone to it. While there is little that can be done to stop a stroke while it is occurring, there is much that can be done to treat and diminish the consequences of a stroke. The majority of people who survive a stroke do well in terms of living at home, moving about independently and carrying out the normal activities of daily living. Thus, having a stroke definitely does not mean that one's life is irreparably damaged. Anti-Vatha drugs such as Vathachintamani Ras, Ekangavira Ras, Vathaгаjankush Ras etc. are used to treat this condition. In addition, a special regimen, including Snehana, medicated oil application, Pindasweetana, fomentation, Nasya, nasal drops, and Basti, special type of enema therapy, strengthens the muscle tissue and restores the neuromuscular function. These therapies expel toxins from different channels. They clear disturbances or blockades, increasing peripheral blood supply. Recovery of damaged brain tissue. A damaged brain can heal. Sometimes the healing is rapid and complete when the damage is minimal, as with a transient ischemic attacks. But recovery can also occur after a regular stroke when the damage is greater. Recovery may be complete but usually, after a regular stroke, it is partial. However, the recovery of brain function can be quite significant, because other parts of the brain can assume some of the functions of the damaged portion. Thus, it is very important to keep the possibility of brain function recovery in mind and do everything that will encourage recovery. Regaining muscle function. When the brain is damaged by a stroke, the muscles controlled by the portion of the brain are affected. For example, when certain parts of the left brain are damaged, the right arm or leg may be weakened or paralyzed. Initially after the stroke, the muscles are limp and move poorly or not at all. As time passes, whether they begin to function appropriately again or not, the muscles become tense. Fortunately, muscle function can be recovered, and the brain is able to substitute some new connections for damaged ones. Furthermore, muscles unaffected by the stroke can learn to do new things and thereby substitute for impaired muscles. This recovery process requires panchakarma therapies and rehabilitation measures. However, nothing will work unless the patient himself or herself actively, persistently and regularly is involved in this program. Only personal effort will make the program work. There is another important issue to remember. Unused muscles atrophy, they lose size and strength. In the process of atrophying, they also often scar and become less flexible. The processes of atrophy and scarring can only be prevented by use of the muscles. In Ayurveda, Abhyangana Chikitsa or massage therapy works on this principle. Massage therapy gives the patient adequate exercise by passive movement of muscles and joints. Recovery of mental abilities. After a stroke, some people's emotional states change and they become susceptible to what appear to be rapid mood swings. They may laugh or cry suddenly, or become angry or withdrawn. While these mood changes are not a consequence of altered thinking, to other people they may appear to be a result of thought changes. Mood changes are actually a result of damage to brain tissue and usually cannot be controlled by the patient. It is important for families and caregivers to recognize this and find ways to compensate or minimize the impact of outbursts. It may be that the emotion fragility is also a product of frustration, anger and depression, which are common among people who have had strokes. Difficulty in speaking after a stroke may happen. It is usually caused by loss of ability to understand or by loss of control of speech muscles, or by both. Whatever the cause, immediately after the stroke many people will not speak at all. Then abnormal speech will appear and improve gradually until normal or nearly normal speech returns. It is important to recognize that sometimes, poor thinking is largely a result of reduced speed of thought. However, just as people with strokes can learn again how to do physical activities such as walking and eating, they can also learn, to some extent, to think and speak again. In all these areas of mental recovery, patience and assurance have a very important role to play. Managing abnormal sensations. Abnormal sensations, because of a stroke, can be quite bothersome. Sometimes there may be simply numbness, but there can also be pain in the affected portion of the body or loss of the normal sensation. Commonly such sensation disappears or subsides significantly. However, sometimes they persist. When they persist, people sometimes gradually lose notice of them. Ayurvedic drugs such as Mahavatha and Ras can sometimes be effective without causing undesirable effects. Ayurvedic remedies, Ganja Tela, is one of the effective external applications in paralysis. It is prepared by boiling together the pulp made of equal quantity of ganja seeds, rati or gangachi, and long pepper, into oil or mustard oil, 4 times of the pulp, and buttermilk, 4 times of the oil, on slow flame. After evaporation of the water content, it is bottled and used as a liniment. Take the decoction of the bark of the root of drumstick with fried asafoetida and rock salt in doses of 20 milliliters. This is to be taken for a minimum period of 40 days. Mullerishta is very effective for toning up the nervous system. About 4 teaspoonfuls of it mixed with equal quantity of water is given twice daily until the symptoms subside. Mahanarayana Tela is good for external massage. Warning signs. 1. Sudden weakness or numbness in the face, arm or leg. 2. Sudden dimness or loss of vision, particularly in one eye. 3. Sudden difficulty in speaking or understanding speech. 4. Sudden severe headache with no known cause. 5. Unexplained dizziness, unsteadiness, or sudden falls, especially in conjunction with the other warning signs. 6. Occasionally, strokes cause double vision, drowsiness, nausea or vomiting. Because warning signs sometimes may last only for a few minutes and disappear, it may be tempting to ignore them. However, these many strokes could be your body's warning of a future full-blown stroke. So, even if the symptoms go away quickly, seek medical help right away. Risk factors. 1. High blood pressure. 2. Cigarette smoking. 3. Heart disease. 4. History of stroke. And 5. Diabetes. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination, an Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type, and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva, Sarado Vardhamanaha. Shatam Hemantan, Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.